This segment is sponsored by Advanced Pain Care.
The month of November brings Veterans Day, and we want to celebrate our service members. We're speaking with Advanced Pain Care this morning to talk about the resources that they can provide our local heroes. I've got one of them on the line. It's Dr. Bradley Wisler. He's going to tell us a little
Hello.
bit more about it. Good morning, Doc.
Good morning, Rosie. Thanks for having me.
Thanks so much for being here, Doctor. So we want to take a moment to honor you here as well. Let's talk about what celebrating our veterans means to you.
Veterans Day, I think in general, it's a day for us all to celebrate or to honor all those who served in the military, past or present. A day where families, schools, businesses, all the organizations get a chance to really think about it and reflect on those who have served. Joining the military, personally for me, my experience, it's an intense sacrifice, both for us as the individual and for the family members involved too. We sign up, we serve, we commit our lives and bodies to our country, and I honor that for everyone and respect it. But Veterans Day to me also means honoring all of our family members who make those sacrifices too. The wives, the husbands, the children, the parents. It's not just the service member that makes those sacrifices, it's the entire support system. And so that's what it means to me personally. So, to my wife and kids, I say happy Veterans Day too.
Oh, that's so sweet. And thank you, of course, for your service to our country. We really appreciate everything you've done. Let's talk about the services a pain management specialist can offer veterans here in town.
We offer the same pain services to our vets as we do to the non-military patients. We don't want to really treat them any differently. We want to offer the same kinds of services. This can include history and exam. We try to find the root cause of the problem and treat it. We do pretty advanced therapies here, like interventional therapies, including injections and ablations and spinal cord stimulators. And so we want to make sure that we offer that to the military community too. Being a vet myself, I understand the unique pain problems that a vet has. However, it can be different than the non-military person. So many times we see earlier degeneration in the vet, more severe degeneration from that intense wear and tear a military career can subject them to. And so we understand that, I understand that, and we treat it appropriately. We just want to make sure that the vets realize they don't have to live their lives in constant pain, and we can help.
Let's talk about some resources that you think are important for veterans transitioning back to civilian life, because this has been a recent journey for you as well, correct?
Mental health awareness is such a key issue in the general community, and it's a big focus with the Veterans Administration right now to make that a big part of separation. And so nowadays, separating military members, we're actually required to go through a 5-day transitioning course. It covers everything you need with the transition, family resources, education, health benefits, mental health options. Really, it's great. And nowadays we're pretty well primed to have all this information on separation. But, for those who separated before this was available, or who just, forget about it or whatever, or don't know about it, there's the internet. Everything on the internet right now, you can find so much available. Just do a basic search. You can find anything on there. Tons of veteran services are available. Some of my favorites that I typically use is AMVETS. That's a great option. Any of your local veteran resources centers. I know there's a couple here in Austin. Just the regular va.org and your eBenefits website. There's a lot of resources out there.
And sounds like some of those are finding your community again once you've kind of transitioned back. So maybe a support system there. And I want to talk about how that filters into the way that you are able to bring experience to the table with how you treat patients. How does the military background filter in?
It's something that, I like to look back on and really digest my own experience and see how I can use that now. And so, I served 4 years of active duty in the Air Force. I was brought there. I created from scratch, from nothing, a pain management program for my base when I started. I used my knowledge and experience from all my trainings before to kind of initiate just a basic pain management program. But then I tweaked it over the years and I fine-tuned it. I took it from, really basic to one that was pretty advanced. It was pretty cool. We went to some really advanced therapies while I was there, all the interventional options that we talk about nowadays. Injections, ablations, and spinal cord stimulators is probably the biggest thing that I think that I brought to the military community. It's something that's growing kind of worldwide right now, and I think that it's something that all vets should know about. And I was pretty proud to bring that to my community specifically. Aside from that, I also completed a tour in Iraq. I was part of an advanced ground surgical team. I performed trauma surgeries in a pretty far off remote location. And this put me in another unique position to really understand the pain problems that come with the deployment, the wear and tear physically and mentally. I lived it, I breathed it. And so those two things, I know what to expect, I know what to see and how to treat it. And I've lived that firsthand experience. And so I know it. And so I take these experiences and I think I connect with our vets on a bit of a deeper level than usual. And it's pretty cool.
Austin's lucky to have you. Doctor,
Thank you.
again, thank you so much for your service. A happy Veterans Day, not only to you, but to your wife and kids as well. And thank you so much for your time today.
I really appreciate it. Thank you so much.
To learn more about what you could do if pain wasn't holding you back, talk to the doctors at Advanced Pain Care. Go to austinpaindoctor.com to get help managing your pain today.
This segment is sponsored by Advanced Pain Care.